Hi, it's Paul Feuerstein here, Technology Editor of Dentistry Today. I'm here talking with Robert DelCastillo. Robert,
Hi, how are you?
How are you?
Nice to see you.
Robert's a dentist in Florida.
Periodontist.
In what part of Florida?
Miami Lakes, Florida.
Miami Lakes, Florida.
Yep.
And does quite a number of implants.
Yep.
And we've seen implants come and go, and in our own patients, they sometimes come and go.
Yes, they do.
So we're here talking with the Zest Corporation, and when you think of Zest, you usually think of a overdenture that sort of snaps in and snaps out. Mm-hmm. But Zest has done something completely different all of a sudden. They're changing the game.
Exactly. As of 2016, Zest got FDA approval for their Locator F-Tx, which is using the same concept of an abutment that gets snapped onto an implant, screws in, and then there's an attachment system. So we're able to go from a removable to a fixed clinical situation.
That's the letter
now.
F, fixed.
Yes, exactly.
And so what we can do now is, if you want to do an all-on 4, for example, or all-on 5, or on 6, whatever you feel, but it goes on, the patient does not take this out.
Exactly.
In fact, the patient cannot take this out.
The patient cannot take that off, and actually it's what I call a better mousetrap, because traditionally the all-on 4, 6s, full rehabilitation of an arch have always been screw retains. So the Locator F-Tx eliminates all the screws, eliminates all the screw channels, and eliminates any cement subgingivally that can potentially be an issue. And
that's a periodontal disaster.
Exactly.
And it also allows us to snap it in, and if something breaks, a tooth breaks, something like that, we can get it out.
Exactly, yeah. So we in our practice, we can remove it, but the patient cannot remove it.
Now, what happens though, it sounds nice, but what happens if I have a patient that had, say, an all 5 or 4 or 5 implants on a fixed situation, which is screwed in, and one of the implants fails?
Well, that's always been a nightmare for the whole industry, for all of us. And typically, with a screw retain situation, you usually are looking at much more cost for the patient in terms of having to redo a prosthesis, another surgical procedure, trying to either graft the site, to put another implant in, but usually it comes down to remaking the whole prosthesis, which is an extremely expensive
and very aggravated patient.
So, because of the unique feature of the Locator F-Tx, the abutment has a housing that basically pivots 20 degrees, 360 degrees all the way around. We're able to, if we have enough bone, either widthwise or lengthwise or both, to put in another implant, we can now put in a Locator F-Tx abutment, put on the housing, and pick it up. Okay, so the other implant sites will still be
exactly
screw retained, and then we're able to retrofit, save the patient a tremendous amount of money.
Because we've all tried to retrofit a screw and it does not work.
No, there's absolutely no way to retrofit a full arch screw retain prosthesis.
Even a single, never mind. Just
it will not work. But with the Locator F-Tx, because this is going to snap onto the implant, and then we're going to use like one of Zest's materials, chairside material, which is a dual cure material. It allows us to actually let us seat the prostheses, reinsert the screws, light activated, and now it's all processed in.
Oh, I see.
The implant has failed, right? So you have to clean out. You have to clean up that site. We're going to put in a new implant, okay? Either within the same site, so we have to have. So anatomically, the patient has to have more width of bone, or length of bone, or both, or you have to go either mesial or distal to where the
you still have a little bit of wiggle room.
You have a little bit of wiggle room, about 20 degrees. So you put in a new implant. You now put on the abutment, and they come in different cuff heights, of anywhere of 1 to 6 millimeters. Okay, so you put that on, you torque that down, and then you put it what is called the denture attachment housing that has the retentive component
inside of it,
inside of the abutment. Okay, then you're going to use a processing material or acrylic, put that on the attachment housing, seat the prostheses with the screws. And then when everything sets, you have retrofitted and you have saved the existing screw retain prosthesis.
So how do you get it out?
So Zest has a crown and bridge removal tool, and you'll pop it off. So it's a very simple off and on situation. I removed a full arch prosthesis in my office earlier this week. It took me all of 35 seconds.
Wow.
Okay, all of 35 seconds to pop off an all-on 4.
I gotta say, this has been a great transition from the removables. Now I know they still make the removables. We'll probably talk about that some other time. But FTX, Zest FTX.
Yeah, I think it's the next game changer because the industry is familiar with Zest traditional removable. They're using the same concept, but now they're taking it to a fixed level. So it's brilliant. In my opinion, it's brilliant.
That's great. There's a lot of information on Zest's website too. So this has been great, Robert. I really learned a lot. Thank you so much.
Nice to meet you. Thank you. Thank you so much.